Let's talk about performing cardiopulmonary resuscitation, or CPR, on a child. Performing CPR on a child is very similar to doing CPR on an adult. Obviously, children are a little bit smaller, so we won't be pushing down quite as far in inches, but we'll still want to compress about 1/2 to 1/3 of their chest depth. The ratio of compressions to breaths is the same as well, 30 to 2. For CPR, we're considering children to be from about 1 year old to the onset of puberty.
Arriving at the scene. Is the scene safe? The scene appears to be safe. Oh my goodness, what happened? Something happened to Timmy. We don't know. Timmy, are you okay? Are you all right? I'm going to need some help over here. Timmy appears to be unresponsive.
Once we've determined that the scene is safe to approach and that this child is unresponsive and not breathing, we're going to have somebody call 911 right away and get us a first aid kit and an AED.
This child's not breathing. I'm going to need an ambulance right away to 123. I need an ambulance lane. I'm going to need an AED as well. Do you understand? Thank you. Hurry, this is important.
If you're alone with a child and not near a phone, do about 2 minutes or 5 cycles of CPR before calling 911 yourself. Take the child with you to call 911 and get an AED, and then continue CPR. Start CPR with 30 compressions. Put 2 hands on the center of the child's chest. Push down at least 1/3 of the chest depth. The chest compression rate should be between 100 and 120 beats per minute. Don't lean on the chest. Allow the chest to fully recoil after each compression. Give 2 breaths. Open the airway by doing a head tilt chin lift. Place your CPR barrier device over the child's mouth and nose. If you're using a plastic face shield or you feel safe doing mouth to mouth on the child, seal your lips tightly over their mouth and pinch their nose. If you're using a CPR pocket mask, make sure it's sealed tightly over their mouth and nose. Each breath should last about 1 second, with just enough air to make the chest start to rise. If both breaths go in, repeat the cycle of 30 compressions and 2 breaths until there are obvious signs of life or the ambulance arrives and paramedics take over. If there are 2 first aiders present, alternate every 2 minutes or 5 cycles of CPR. If the first breath doesn't go in and you feel resistance instead, reposition the child's head and try again. If the second breath doesn't go in, assume this child has an obstructed airway. Continue CPR, but look in the child's mouth every time you finish 30 compressions to see if something was dislodged. If you see something in their mouth, quickly roll them into the recovery position and use 2 fingers to sweep it out of their mouth. Unless there are obvious signs of life, return immediately to doing CPR.